Welcome back to your Feel Good Breakfast Show. It is Expresso right here on S3. And of course, it's August, which means that this Women's Month, it's a time to honor the voices shaping our nation. And few have done so with the depth and also consistency of broadcaster and journalist Tsepiso Makwetla. Now, with over 2 decades of experience, Tsepiso has reported on political and social conflicts across our continent, interviewed presidents, and brought the continent's most complex stories into our homes right here. So beyond the headlines, she's also a passionate MNCH and WCAH activist advocating for maternal, newborn, child and adolescent health, especially around childbirth. Now, her advocacy work, philanthropy and mentorship of future journalists reflect a career of not just asking the hard questions, but standing up for the vulnerable. And today she joins us from Channel Africa at the SABC to reflect on her legacy, her work in women's health, and the importance of using media to shift the conversation. So Tsepiso, welcome. Thank you for being here.
Morning. Thank you for inviting me.
Of course, my fellow broadcaster, but of course doing the absolute most all the time. Now, we know that you have reported on so many complex stories throughout the 2 decades that you've honored the country in the way that you have. I'm really curious about your personal passion, though, and the angle that you've chosen to steer your work in, especially when it comes to children's health in your journalism career and, of course, adolescent health and childbirth.
So in 2014, I became an ambassador for a health program called Mom Connect at the National Department of Health, and that was exactly 5 years after I'd had a fresh stillborn. So that's how I became a public health activists, particularly around maternal and newborn child health, and later on adolescent health as well. And it was about preventing further maternal and newborn mortalities. And we've seen child mortality as well. So what really struck me was the fact that when we occupy the spaces that we do, as you and I do, we forget about the privilege. And it's a privilege, really, to be able to shape conversations, to drive them. And there's obviously a level of hubris when one becomes accustomed, and it's not intentional, but for some they're very ignorant of it, that you actually are there for a public service. And there's also an impression that people get that you're beyond certain challenges, certain difficulties.
Right.
And when it happened to me, I mean, I've been doing all the right things. And it literally was what we describe in this space as a preventable death. My OBGYN decided that blood glucose levels of 17 were actually nothing to bat an eyelid at. And I had a fresh stillborn, something that I had to learn and read about. So it led me to understanding science-based evidence on something that ought to really be as routine as having a healthy pregnancy.
Wow.
So I realized that I'm somebody who's exposed, and not just, I don't have the resources in terms of medics, but people in the public health space, but just being able to talk to people who could guide me. What about the women out there who don't have access to information, who don't have access to public healthcare institutions, who either live far or don't even have the money to have their monthly checkups and their weekly checkups? So I realized that the responsibility of what we do comes with that, mirroring the experiences of what women and children, unfortunately, we're talking about adolescent girls right now who go through that.
Right, right. And thank you for the work that you do. I'm really sorry that you had to experience that, but you've really taken a challenging moment and turned it around in service of other people, which is so incredibly beautiful. You know, often when we talk about certain data and statistics, we get lost in the numbers, but we're talking about real people at the end of the day. So as a broadcaster, how do you humanize this? How do you cross over into that space of going, okay, you're more than just a percentage, a number. I'm talking about me, I'm talking about you.
And you know, that's what I found particularly challenging in this space of being a public healthcare activist, particularly MNCH, particularly in WICA. as a Gates Foundation gatekeeper, which is how I came onto your radar, because I've become a gatekeeper since 2023, and being in this community has exposed me to a lot of people who do incredible work, not only in the science, academia, but just also in civil society, etc. But what I realized is, as a journalist, I thought what I've always enjoyed personally is that human touch, speaking to people, getting the personal experiences. So, as I said, I realized I had mine to tell.
Right.
But people are readily, easily to listen to you because they see your face, they hear your voice. But what about somebody who doesn't have access to somebody like you and I? So I really have tried, but I found that also very difficult. Because even now, when I say to my fellow colleagues that if you look at the SDGs, SDG 3 is what I work in, that 49% of countries are still far off their targets, particularly when we talk about maternal mortality. I think it's 56% for child mortality. They don't see the human face of it. When we talk about financial aid cuts, or what we see in the funding cuts in the health space, people are more interested in discussing the politics, the policies behind it, how we go. But what about the women and children who are dying as a result of preventable deaths? If we're talking about nutrition, for instance, teenage pregnancies, lack of family planning, etc. So there are myriad reasons. And the social ills that we don't deal about. We can't talk about a 10-year-old who falls pregnant and we say it was as a result of consensual sex.
Right. Okay, so then what is the responsibility of media, of the space that you and I are in? What can we do better, more? How can you challenge South Africa, to take this on and be the steward of these conversations, perhaps?
I think just remembering that if it's not happening to me, it certainly is happening to somebody that I know. Yeah. It's happening in my community. So as a human being, I think we bear the responsibility to be part of a system that helps women and children and adolescent girls, for instance. As I speak about those social ills, when we talk about sexual assault, it starts somewhere and it continues for a period of time. It's never a once-off. So we bear that responsibility, you and I, of speaking out and protecting vulnerable communities. And unfortunately, now we're even talking about the elderly. But when we talk about things like healthcare workers, they are under strain, but it still baffles me to see that women are dying in public healthcare institutions waiting for hours without service. Women are dying during childbirth because of lack of attention. Institutions are not clean enough or providing nutritional services where we see maternal and newborn death. So all of these things are preventable. So I'm saying you as a professional, you and I as community members, we can do something. Yeah. And as broadcasters, you know, it's great to lead with those salacious stories and talk about Ubanban, what influence or what they've done. And yes,
there's a time and a place.
We work in an era of information on demand, but we do bear the moral responsibility of saving lives, because we can't be saving the lives of those we know. But as members of a community that we're trying to build to thrive, there are simple things that I think that we can do.
Wow. And I hope that that was definitely a call to action for all of those with a platform to do more and do better, and definitely take a page out of your book. Tsepiso, thank you so much for joining us.
Thanks for inviting me.
You've been incredible, and the work that you're doing in the advocacy, health and broadcasting space is definitely stellar, and we can't wait to see you succeed even more than you already have.
Thank you.
Happy Women's Month.
Happy Women's Month to you and everybody there.
100%.